Hi, I'm Neil Beaton. I'm a rural generalist, senior medical officer at Atherton and Mareeba hospitals. I work in advanced practice in emergency medicine and anaesthetics, and I'm also the GP mentor for GMT for an anaesthetics training and advanced skills training. Anaesthetics training is a core part of training to be a rural doctor. I found it very useful because it gives you confidence in managing acute medicine, perioperative care, the emergency department, dealing with airways, etc. So it is a core part of fellowship. It's not a standalone qualification. It blends in very well with the team, and the great thing about it is that you're a core part of an essential service. The anaesthetic training pathway is governed by the JCCA, which is a joint committee between three colleges, the College of Anaesthetists, the College of GPs and the College of Rural and Remote Medicine. That's been in place for many years. The curriculum is basically overseen by the JCCA, and it's implemented in accordance with that set of rules, so that's available to have a look at. The panel will be looking for somebody who is a confident and capable clinician, somebody who's a competent clinician who has good situational awareness and good risk management and the ability to solve problems quickly on their feet. The training takes, for most people, 12 months, the idea is to get sufficient caseload during that 12 months and sufficient support, and part of the role of the GP mentor is to assist the department in making sure that all the skills are covered off. Some people have had to do 15 months, but the majority of people complete in 12 months. A lot of the posts in Queensland are managed by the Queensland Rural Generalist pathway, and they go through a statewide selection process, and that's almost certainly the best way to go about it if you want to be a rural generalist through Queensland Health. For private doctors, it's important to go through your local node and allow the node to help negotiate posts with you. Generally, the anaesthetic departments follow the ANZCA programme, so you get similar to what the registrars in ANZCA get, but it's compressed into a year. At 3 to 6 months, generally there's an introductory assessment to see if you can go on call. That's an important one, but it's not actually a formal part of JCCA. What JCCA recommends is some case reports, which should be rural orientated. Also, there needs to be a summative assessment by your supervisor, which is signed off, which then allows you to take a formal exam, usually in December or January, and that's arranged by the department. What most of us do are regular courses, in courses such as the MST and APLS. We will also go in and do upskilling posts for at least a week every year. Most people do that. There are a range of other options. There are things like 360 feedback, which is important in teamwork, and so it is fairly comprehensive and a requirement in order to maintain your credentials. It's not onerous, and there are grants now for people to be able to maintain their skills to cover some of the costs of some of the courses and some of the upskilling posts. My strong recommendation is to stay in touch with your training post and to return there for upskilling from time to time, and keep in touch with them by phone and try to organise some feedback sessions with them. Training in anaesthetics for me has given me the confidence to be able to manage the resus room and critical care very well. So anaesthetic skills crosses over into critical care, high dependency, retrieval, there's a lot of, and emergency medicine. So generally speaking, it gives you more confidence and ability to be able to manage the critically ill, as well as provide an elective service. So it maintains services in your town, particularly obstetrics. And if you're in a level 3 hospital, you can't run obstetrics without an anaesthetist, an epidural service, and all the other bits that go with the toolkit. So you're really part of the toolkit. So you are genuinely part of the team, and that creates, for me, that's allowed me to have a degree of credibility in the team, and take some of the leadership role in critical care with my colleagues. But basically it builds friendships and great teamwork. Anaesthetic training is a very useful set of skills for any doctor, but for a rural generalist it's kind of core business. Surgery and anaesthetics clearly were the first focus of rural doctors, and there was a reason for that. And at the end of the day, you can maintain safe obstetric services if you've got a safe anaesthetist on your team. And so the big sell is that you will maintain services which otherwise wouldn't be there. And I think that's the most important thing.